If you're wondering if your child's frequent nosebleeds are preventable or even something worth worrying about, stick around. That's what this video is all about. Hi everyone, I'm Dr. Eileen Shi, a board-certified holistic pediatrician who works with thousands of parents like you who want natural and holistic remedies to solve their children's health issues by addressing the root of the problem. In this video, we are going to talk about the anatomy of the nose, the factors that trigger nosebleeds, and red flags that I look for, particularly as a pediatrician, when parents bring their little ones to clinic with a bloody nose. Now, nosebleeds, medically called epistasis, is pretty common, especially in the pediatric population, specifically in the toddlers to school-age kids like 2 to 6 years of age, and also in the adult population. Now, nosebleeds tend to get a bad rep because parents are generally worried that frequent nosebleeds in children may be a sign of something more serious like cancer, bleeding disorders, or something bad. I will get to these red flags to watch out for in nosebleeds later on in this video, but I will say that fortunately, in children, it is very rare for nosebleeds to represent something serious or something else is going on. So in other words, most nosebleeds in kids are pretty benign. Now let's take a brief look at the anatomy of the nose and where the blood supplies are coming from. Most nosebleeds in children happen in the anterior part of the nose, which has many small capillaries and branches as you see, collectively known as the Castleback plexus. These small vessels are superficial, close to the nostrils, and can break down and be affected by environmental factors. And these nosebleeds are usually pretty benign. Common causes of anterior nosebleeds in children are usually due to dry climate, digital trauma, and cold and seasonal allergies. Now, if your child has frequent nosebleeds that are self-limited within 5 to 10 minutes, almost 10 out of 10 times, this is exactly what I recommend to my patients' families. Number 1, nasal saline for the nose. A wet nose will bleed less. I recommend using a saline nose drop twice daily in your child's nose. And at nighttime, you can use a gel form of saline, such as air or air saline gel. This works better generally than applying Vaseline or petroleum jelly because it improves the mucosal integrity of the nose. Try doing this daily for 2 to 4 weeks, and most of the time, the nosebleeds will be much less frequent. Number 2, apply pressure on the soft part of the nose, not the bony part. As you recall from the anatomy diagram, most of the vessels are in the soft tissue part of the nose. Number 3 is to minimize nose picking. This may be an obvious one, but it is worth mentioning. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. Nosebleeds can also be from the posterior part of the nose where there are deeper arteries and vessels. Posterior nosebleeds can be harder to control. It can be associated with blood running down the back of the throat and can be associated with considerable amounts of blood loss. So having said that, posterior nosebleeds are very rare in children. The most common cause of posterior nosebleeds in children is trauma, like a direct injury to the nose or a fall, or in some cases from recurrent episodes of violent vomiting, as that can cause injury to the back vessels of the nose. So posterior nosebleeds are actually much more common in adults where there could be more underlying conditions. So if your child has frequent nosebleeds, these are some of the questions you may get asked by your doctor to collect more information on the history to come to the right evaluation and diagnosis. Questions I often ask my families when their child has nosebleed is, when does it happen? How frequently does it happen? How long does it last? And what medications or supplements is your child on currently? Are there any frequent bleeding from other places on the body, like dental gum? And are there any family history of bleeding or blood clotting problems? Now, the red flags in nosebleeds that would prompt a further investigation and evaluations are generally prolonged nosebleeds. Now, these are nosebleeds lasting more than 10 minutes. Large amounts of blood draining down the throat, or blood clots, and signs of any blood clotting disorder such as delayed wound healing, bleeding in the joints, and family history of bleeding water. Someone might say, oh yeah, my uncle always has a bleeding problem in his joints. Also, if the nosebleed is impacting your child's daily life, like having to sit out on sports practices, frequent nurse visits, and having to get picked up from school, despite the family having already tried to consistently moisturize the nose, it may warrant a specialist referral to the ear, nose, throat doctors who can determine if a nasal endoscopy is indicated. This video is intended to be educational, and even though I am a pediatrician, the information on this platform is intended to spark conversations between you and the care team that helps provide the most individualized care for your children. In our Las Vegas-based practice, me and my team work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing the unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, just click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatrics.